Isoprinosine is a synthetic complex purine derivative with immunostimulatory activity and nonspecific antiviral activity. Indications: treatment of influenza and other acute respiratory viral infections. Infections caused by the herpes simplex virus of the first, second, third, and fourth types, genital and labial herpes, hepatic keratitis, herpes zoster, chickenpox, infectious mononucleosis caused by Epstein-Barr virus, cytomegalovirus infection, severe measles, papillomavirus infection, papillomas of the larynx, vocal cords, fibrosis type, papillomavirus infection of the genitals in men and women. Words: molluscum contagiosum, subacute sclerosing panencephalitis. How to use: tablets are taken orally after meals with a small, about half cup amount of water. The recommended dose for children from 3 years old, body weight from 15 to 20 kilograms, is 50 milligrams per kilogram per day, divided into 3 to 4 doses. Adults 6 to 8 tablets per day. Children half tablet per 5 kilogram body weight per day. In severe forms of infectious diseases, the dose can be increased individually up to 100 mg per kilogram of body weight per day, divided into 4 to 6 doses. The maximum daily dose for adults is 3 to 4 grams per day. For children, 50 mg per kilogram per day. Duration of treatment. Acute diseases. The duration of treatment in adults and children is usually 5 to 14 days. Treatment should be continued until the disappearance of clinical symptoms and for another 2 days in the absence of symptoms. If necessary, the duration of treatment can be increased individually under the supervision of a physician. In chronic recurrent diseases in adults and children, treatment should be continued in severe courses of 5 to 10 days, with a break in admission of 8 days. For maintenance therapy, the dose can be reduced to 500 to 1000 mg per day, 1 to 2 tablets for 30 days. In case of hepatic infection, adults and children are prescribed for 5 to 10 days until the symptoms of the disease disappear. In the asymptomatic period, 1 tablet 2 times a day for 30 days to reduce the number of relapses. For papillomavirus infection, adults are prescribed 2 tablets 3 times a day. Children half tablet per 5 kg body weight per day in 3 to 4 doses for 14 to 28 days as monotherapy. For recurrent genital warts, adults are prescribed 2 tablets 3 times a day. Children half tablet per 5 kg body weight per day in 3 to 4 doses per day, either as monotherapy or in combination with surgical treatment for 14 to 28 days, then with a threefold repetition of the specified course at intervals of 1 month. With cervical dysplasia associated with the human papillomavirus, 2 tablets are prescribed 3 times a day for 10 days, then 2 to 3 similar courses are carried out with an interval of 10 to 14 days. Contraindications: hypersensitivity to the components of the drug, gout, urolithiasis disease, arrhythmias, chronic renal failure, children's age up to 3 years, body weight up to 15 to 20 kilograms, pregnancy and breastfeeding period. Carefully. Caution should be exercised when prescribing isoprinosine with drugs, xanthine oxidase inhibitors, diuretics, zidovudine in acute liver failure. Special instructions: isoprinosine, like other antiviral agents, is most effective in acute viral infections if treatment is started early in the disease, preferably from the first day of the disease. With prolonged use after 4 weeks of administration, it is advisable to monitor the function of the liver and kidneys every month, transaminase activity, creatinine, uric acid levels in blood plasma. The drug should be used with caution in patients with acute liver failure, as it is metabolized in the liver. Side effects: immune system disorders, infrequently, urticaria, angioedema, frequency unknown, hypersensitivity reaction, anaphylactic reactions, anaphylactic shock. Nervous system disorders, often headache, dizziness, fatigue, feeling unwell, weakness, infrequently nervousness, drowsiness, insomnia. Gastrointestinal disorders, often nausea, vomiting, epigastric pain, loss of appetite, infrequently diarrhea, constipation. Liver and biliary tract disorders, often a temporary increase in the activity of transaminase and alkaline phosphatase. Isoprinosine is a synthetic complex purine derivative with immunostimulatory activity and nonspecific antiviral activity. Indications: treatment of influenza and other acute respiratory viral infections. Infections caused by the herpes simplex virus of the first, second, third, and fourth types, genital and labial herpes, hepatic keratitis, herpes zoster, chickenpox, infectious mononucleosis caused by Epstein-Barr virus, cytomegalovirus infection, severe measles, papillomavirus infection, papillomas of the larynx, vocal cords, fibrosis type.